This is the site that greeted staff on level 8 and 9 at Steve Biko Academic Hospital this Saturday. From morning until afternoon, the maternity ward was in darkness as the Gauteng Department of Health carried out urgent repairs on its electrical infrastructure.
We have switchovers which were old, and they were impacting on a challenge whereby when the municipality is off in terms of giving us power from the grid, we will expect generators to kick in. So that delay was caused by the switch, which were old, and we have now started with the process to say, let's change them, have the new ones, so that when there's no power, then there's an easy flow when coming to the changeover.
And says the changeover intervention started in September 2025 and is being done in phases.
We are doing it in phases because we don't want to interrupt the entire facility. So that's why we focus on levels. We are also to change our UPS system. We are done with that one. And all the affected levels, which is level 8 and 9, we are then to remove or relocate some of the high risk or critical patients, which doctors assisted to say these ones need to be removed because they rely on electricity.
Steve is one of Gauteng's busiest academic hospitals. It serves Tshwane and referrals from as far as Limpopo, Mpumalanga and the Northwest. But the department says its annual budget cannot keep up with population growth and demand, even though the province's health budget has seen a slight increase over the last 3 financial years, with 2025 to 2026 being the lowest at 66 billion and the current financial year the highest at 70.3 billion.
We have many people that are coming into Gauteng, migration. You know that Gauteng has 4 academic hospitals, and one of the biggest hospital in the southern hemisphere, which is Para. The other academic hospitals, they are always overwhelmed, and it's something that we are following it up with the relevant provinces, because when we are given budget, they look at the numbers that we cater for as Gauteng, but that will be outside what is reflective in our stats.
Addressing the funding challenge, however, rests with the Premier.
Responsible for that, and there are platforms for him to ventilate there.
Allegations of frequent equipment failures at Steve Biko Academic Hospital, as raised by patients and opposition parties like the Democratic Alliance, where recently they claimed operations were halted for a month due to air conditioning failures.
Is overwhelmed, and for the opposition party or politicians, they will always look for something that they must show that they are taking care of the facilities or doing work, which is something that they must do, but sometimes they need to be factual.
Man says returning the hospital to normal operations will take about 16 hours, as all relocated patients must be moved back to their original wards. Nomvio Ntanjana, SABC News, Pretoria.